Okay. So Gore, KV, and Vishal, are you all ready?
Yes, ma'am.
Yes, ma'am.
Okay. So Gore and Vishal, where is Vishal, your partner? Gore, where is Vishal?
Ma'am, I don't know, ma'am.
If you have his number, contact to him once. If he's not coming, then both of you can start with the topic. Just call him once.
Ma'am,
Hmm?
we can show through slide searches.
Yes, yes.
Okay,
You
ma'am.
can show slides also. You are with Rohan, right?
Yes, ma'am, but he has prepared as a...
Okay, okay, no problem.
Okay, ma'am.
Have you contacted Gore to Vishal? Yes, Gore and KV. Are you ready?
Yes, ma'am.
Okay, so both of you turn on your videos, Gore and Vishal. We don't have much time to waste, okay? So Gore and Vishal, you please turn on your video. Okay, so who will start with the topic? Gore or KV?
Ma'am, KV.
Ma'am, I'll start.
Gore, okay. Gore will start,
No,
okay.
ma'am, KV. Ma'am, KV.
KV will start. Okay, KV start.
Ma'am, actually, the words are coming out inverted. The chart.
Huh?
The chart.
Chart
The
paper is
words
coming
are
what?
inverted.
What happened? Inverted? You just do back camera, you do. Yeah, it's coming straight only. Before starting the topic, you introduce yourself to the group.
Okay.
With your
Yes, ma'am.
name, topic.
Ma'am, is my chart paper clear?
Yes, yes, it is. Others, is it clear? Is it okay? Are you all able to see the chart paper?
Yes, ma'am.
Okay. Yeah, it's okay, Kevin.
Yes, ma'am.
Okay. Good afternoon, everyone. Today, the topic that my group has prepared is tuberculosis. My name is Kevile Tino, and I will be talking on the introduction of tuberculosis, the types and symptoms of tuberculosis. The term tuberculosis was termed by Johannes Collin in the year 1834. Tuberculosis is a contagious and potentially life-threatening disease transmitted through the air. While it can affect any part of the body, such as the brain, kidney, and spine, TB usually affects the lungs. On March 24, 1882, Dr. Robert Hooke announced the discovery of Mycobacterium tuberculosis, the bacteria that causes tuberculosis. It has been known to mankind since ancient times. It is believed that the genus Mycobacterium was present in the environment about 150 million years ago, and an early variant of M. tuberculosis was originated in East Africa about 3 million years ago. TB was defined as captain of all those of that because of its epidemic proportion in Europe and North America, determining 1 in 4 deaths. The Indian TB Report 2020 stated that there are 24 lakh TB cases and 79,144 deaths due to TB in India. Overall, the TB burden in India is the highest in Uttar Pradesh. The world celebrates World TB Day on 24th March. It is celebrated on this day because Dr. Robert Hooke announced the discovery of Mycobacterium tuberculosis, the bacteria that causes TB, which led towards diagnosing and curing of the disease. This TB spreads by respiratory droplets such as coughs, sneezes, and also saliva. TB is partly preventable by a vaccine, and the vaccine name is Bacillus-Calmette-Guerin (BCG). It is often given to humans at infant. It was developed over a period of 13 years from 1908 to 1921 by French bacteriologists Albert Calmette and Camille Guerin. This is the Mycobacterium tuberculosis when viewed under a microscope. This is the bacteria that causes TB. It is a rod-shaped body, approximately 0.2 millimeter long, and it is a very slow-growing bacteria. TB is again divided into three parts, that is, the active TB, miliary TB, and latent TB. Active TB. Active TB is an illness in which the TB bacteria are rapidly multiplying and invading different organs of the body. If you are diagnosed with an active TB, be prepared to give a careful, detailed history of every person with whom you have had contact, since the active form may be contagious and people will need to be tested as well. Miliary TB. Miliary TB is a rare form of active disease that occurs when the TB bacteria finds its way into the bloodstream. In this form, the bacteria quickly spread all over the body in tiny nodules and affect multiple organs at once. This form of TB can be rapidly fatal. Latent TB. Many of those who are infected with TB do not develop overt disease. They have no symptoms and the chest X-ray may be normal. The only manifestation of this encounter may be reaction to tuberculin skin test or interferon gamma release assay, that is the IGRA. However, this is an ongoing risk that the latent infection may escalate to active diseases. This is the human lungs that is infected by the Mycobacterium tuberculosis. This purple, the purple colored is the bacteria when viewed under a microscope. Now, according to the type of TB that you are infected with, your symptoms will also vary. If you are infected with active TB, your symptoms may include cough, chest pain, weakness, weight loss, fever, chills, and sweating at night. If you are infected with miliary TB, your symptoms can be vague and difficulty to identify. They include weight loss, fever, chills, weakness, general discomfort, and difficulty breathing. Infection of the bone marrow may cause severe anemia and other blood abnormalities, suggesting leukemia. The symptoms of active and miliary TB are quite similar, but in the symptoms of latent TB are different. Persons with latent TB infection do not feel sick. They do not have symptoms but can potentially develop active TB. These are few of the symptoms that a person suffering from TB will suffer from. Cough lasts more than 3 weeks, weakness of the body, weight loss, chills, blood in septum, and chest pain. The causes and treatment of TB will be explained by Gore.
Okay. Okay, go.
Ma'am, hello.
See.
Good afternoon, everyone. Myself, God. Today, I will discuss causes of TB and treatment of TB. First, we discuss what is TB. Ma'am, tuberculosis is a bacterial infection spread through inhaling tiny droplets from the cough and sneezes of an affected person. It mainly affects the lungs, but it can affect any part of the body, inhaling the tummy, glands, bone, and nervous system. Causes of TB. Tuberculosis is caused by a type of bacterium called Mycobacterium tuberculosis. Although TB is spread in a similar way to cold and flu, it is not a contagious. People with weak immunity system and those suffering from grave illness such as HIV, healthcare workers who are exposed to patients with active TB, people suffering from diabetes, kidney diseases, people who have been using steroid from a long time. Common symptoms of TB: coughing, fever, weight loss, weakness, and feeling very tired. Treatment of TB. Treatment of TB: antibiotic to kill bacteria. Chemotherapy has revolutionized the management of tuberculosis. Most common TB drugs. If you have latent tuberculosis, you may need to take only one or two types of TB drugs. Active tuberculosis, particularly if it's a drugs-resistant strain, will require several drugs at once. The most common medication used to treat tuberculosis include isoniazid, rifampin, ethambutol, pyrazinamide. Medication side effect. Serious side effects of TB drugs are not common but can be dangerous. When they do occur, all tuberculosis medication can be highly toxic to your liver. Complete.
Finish.
Yes, ma'am.
Okay. Okay, good. Okay, so KV.
Yes, ma'am.
Okay, KV and Gore, both of you can ask your friends if they have any doubts, and if they don't have any doubt, then you can ask them questions. Participants, you can ask them questions. If you have any doubt regarding anything, you please ask them the question from the participants. Any doubt, anyone? Hmm? You all have doubts or not?
Ma'am,
Hmm.
I want to ask question, KV.
Who?
KV,
Okay, KV. Okay, ask her.
good evening, AV. I want to ask about the symptom of tuberculosis.
Okay, so symptoms of tuberculosis. If you are three types of TB, so according to what type of TB you're infected with, your symptoms will also vary. The first type of TB is the active TB, and so if you have the active TB, your body will suffer from cough, chest pain, weakness of the body, weight loss, fever, chills, and sweating at night. And if you are infected with the miliary TB, that your symptoms will also be quite similar to the active TB, but this miliary TB, it will affect your bone marrow and also your blood, leading to leukemia as well. And latent TB, if you're suffering from latent TB, your symptoms will not be very visible, but this latent TB may develop into active TB as well.
Okay, thank you, KV.
If anyone
Any more?
has any
Any
more
others?
questions.
Yes or no? Okay. Okay, KB. Now you ask questions to them. You can call out the name and you can ask them the questions. Don't show them the chart. You just ask them the question. Turn on your video at least. Okay, KV, ask them question.
Ma'am, I want to ask Sakani.
Okay. Ask her.
So, what are the symptoms of malarial TB?
TB.
Like cough,
Pardon?
cough,
Be a bit
Yes,
louder.
cough
What you're
and
saying?
cough, man, cough.
Okay, cough. And don't say only cough. It lasts for more than 3 weeks. Okay, cough that lasts for more than 3 weeks is a symptom of TB. Not just cough. Cough though anybody can have. Then any more symptoms? Ask her, KV, if she have any more, if she knows any more symptoms.
so, apart from a cough that lasts 3 weeks, what are the other symptoms that a person will suffer from if they have malarial TB?
Is that the question? I don't understand that.
What are the symptoms of malarial TB?
Miliary.
Yes.
Miliary, like a vagu, weight loss, weakness,
Yes.
uh, fever, and then difficult breathing.
Difficulty in breathing.
Yeah, difficulty in breathing. Then chills,
Yes.
leukemia.
Yes.
Only that much.
Okay. Ask
Okay.
somebody else now.
Thank you.
KB.
Ma'am, let me.
Lakme Chakma.
Yes, ma'am.
Say KB, question her.
So, what is the name of the vaccine of TB?
Say fast.
Ma'am, actually,
Lakme.
my net was slow now, so I can't hear their voice.
Okay, she asked you something. Ask again, KB.
What is the name of the vaccine of TB?
What is the vaccine that is given for tuberculosis? Ask somebody else. Maybe our network is not good. Ask somebody else.
Ma'am, Taba Ania.
Tabania. Yes, Tabania. Where is Tabania? Whoever doesn't answer me, I will directly give you absent, okay? And yesterday also 2 students I have given you absent because you have not answered. Ask somebody else. Ask somebody else, KB.
Dynasty.
Dynasty. Dynasty is present or absent? Dynasty is present or absent? Okay, mark him absent. Okay, Dynasty, Anya, and who was there? Okay, these 2. Ask somebody else. See, we don't have time. Okay, do fast. Students also, participants, please ask fast. In your time will also come for seminar presentation, and when others will ask and they won't answer you back, that time you will understand. Ask them. Ask somebody else. KB.
Yatulika.
Yatulika.
Yes, ma'am.
KB, ask.
What is the vaccine name for TB? The vaccine.
Yes, Kiwi.
The vaccine name for TB. The vaccine for TB. What is the name of the vaccine?
PCG.
Okay. Can
PCG.
you please tell the
What she
full
said?
form of BCG? BCG.
Oh, acha,
Okay.
okay.
Bacilla clamati guerin.
When
Pardon?
it is given?
Bacilla clamati guerin.
Yes. And when was it? By whom was it discovered?
It was discovered by
Okay, you tell her the answer, KB. Who
Okay,
discovered?
it was discovered by a French bacteriologist, Albert Calmet and Camille Guerin.
Thank you, Kevi.
Thank you.
Okay. Okay, KB. Gore, you ask questions.
Ma'am, Rohan.
Rohan.
Yes, ma'am.
Rohan,
Yes, ma'am.
ask.
Hello.
Gore, ask.
Rohan says some causes of TB.
Causes of
TB.
causes
TB.
of
TB.
tuberculosis. The cough, sneezing. Hello.
Hello.
Hello. Hello.
Ha, Rohan, say. Gore, Gore, he's
Yes,
answering you
ma'am.
something.
Yes, ma'am.
Cough, sneezing, he's saying all this. Is it correct?
Cough, sneezing.
Yeah, ma'am. Rohan says
Okay.
some treatments of
Ask
TB.
second question. Treatment. To whom you will ask?
Rohan. Ma'am, Rohan.
All Rohan. No. You already asked him the causes. Ask somebody else now.
Ma'am, Srijana.
किसी और का पूछा अभी?
Ma'am, Srijana.
सृजना.
Yes, ma'am.
हाँ. Question
Ma'am,
करो घोर.
treatment of TB. Srijana.
What is the treatment of TB?
Avoid the close contact with the sick person. Then you should immunize the baby at the birth with the BCG vaccine.
Correct word?
Yes, ma'am.
Okay. Ask one last question.
One minute.
Ask one last question,
Ma'am,
Gaur.
Jondeep.
Okay,
Ma'am, Jondeep.
Jondeep.
Yes, ma'am.
Question karo, Gaur.
Ma'am,
Ask him the question.
Symptoms of TB disease. Jondeep.
Symptoms of TB disease. Say, Jondeep.
Coughing, headache. Coughing, headache.
Coughing only. Coughing is not the answer. Okay, coughing for more than 3 weeks, you have to say. Sometimes normally also we used to cough, then what, we have TB or what? No, no. If it's more than 3 weeks, it's known as TB. And what more?
Headache.
Headache and
Sneezing.
correct word?
Yeah, ma'am.
Body shakes.
Body shake?
Sneezing.
Not body shake, body ache. Okay.
Body ache, yes.
Gaur? Are the answers okay? You are muted. Okay. Okay. So, okay, then thank you to both of you. Okay, both Gaur and KV. Your presentation was good. Okay, and your interactive sessions was also okay, but just because of these participants, they don't to answer fast. Maybe they are sleeping. Be it whatever, but at least you all have tried. Okay, yesterday's one was also good. Today's one is also good because you have tried and you have done your best. So thank you. Now you please join for the second class, and in the second class, Likhayatu, Apitaku, and Tabayakar will have their presentation. Okay, you join again, join the class again. Likhayatu, Apitaku, and Tabayakar. Topic is measles. Join the class again.
Ma'am.
Leave the meeting and join the class again.
Ma'am, this Apitaku is not there, and participants are only
Okay, you and
Tabayakar and me.
Tabayakar.
Okay, ma'am.
Okay. Both of you present measles. Okay. After you, Rohan and Srijana will present. Okay.
Thank you, ma'am.
Okay. Join the meeting again.